Mr. President, today the American people are making sacrifices to keep themselves, but their families and their communities safe. Healthcare providers, grocery store staff, state and local government workers, truckers, bank tellers, journalists, countless others are doing important and necessary work on the front lines of this crisis. Both as a senator from Vermont, but also as a member of this chamber for more than 40 years, I want to send my profound thanks to the millions of people around the country who are trying to help us and are sacrificing. I spoke earlier this afternoon with the governor of Vermont, Governor Phil Scott. He's about to take very significant steps further in Vermont, which will cause us economic problems in the short run, but protect the safety and the health of all Vermonters. The governor is a Republican, I'm a Democrat. I applaud and support what he has done. It is time for all of us to stand together. But right now, we're also close to expressing our understanding of the sacrifices of the American people and doing it more than words. I believe we're very close to reaching a bipartisan agreement that's going to provide direct and immediate relief to working people and families in our country. It is time for reality to trump rhetoric. We've had too much talk of what we might do, could do, should do, shouldn't do. It's time to go to reality. We've had far too much rhetoric. As Vice Chairman of the Senate Appropriations Committee, I want to provide senators with an update on the status of the negotiations in the Appropriations Committee between myself and Chairman Shelby. And I might note in this that our staffs, both the Democratic staff and the Republican staff, have worked so hard many, many times to midnight, 1 a.m. in the morning, starting again very early in the morning. I know, because I've been on the phone with them much of that time. And even though my offices here and in Vermont are working outside the buildings, they're working by telecommunications. They are working. And because of that hard work and the fact that senators in both parties are talking to each other and again, talking about reality versus rhetoric, there's much we've already agreed upon. And I'm very confident that we can reach a deal that will help millions of Americans in need. Hospitals, community health centers, the healthcare institutions we will rely on in the coming weeks and months need to be ready for a potential surge of patients. In our agreement, we're securing hundreds of billions of dollars in direct assistance for these vital institutions. Now, across the country, we're hearing reports of medical care providers and first responders reusing masks, or first responders resorting to covering their faces with bandanas for protection. In this, the wealthiest nation on earth, there's no excuse for that. Presiding officer is a physician. He knows the needs that people have to take to protect themselves when they're in hospitals. My wife, the medical surgical nurse, she knows what is needed. And we know that what we're seeing is unacceptable. Increasing their potential risk of exposure to the coronavirus because they do not have the tools and resources they need to do their job, that only puts further strain on our healthcare system, to say nothing about the personal danger to those men and women. So we fought hard in this bill to include resources to make sure the healthcare and police officers, National Guard members, scientists, and many more have access to the personal protective equipment they need. In times of crisis, it is critical that we support the most vulnerable among us. And that's why I fought to include significant new resources for programs that provide food to those in need, including child nutrition programs, SNAP, and senior meals. Because I think every one of us should know, and this is very sad to have to say, as this public health crisis progresses, the demand for nutrition programs is only going to grow in the coming months. And I also fought to secure resources for the homeless. Without a clean, safe place to go, are at a much higher risk of contracting the coronavirus among themselves, but also spreading it in their communities. Vermont is a small and special state. It was when my ancestors came there in the 1800s. It's where Marcel and I were born. It's a place that is very special to us. And while I represent a state where much of it is rural, every member in this chamber represents a rural community, every one of us. And we will ensure that they are not left behind, because in our bill we will support rural business. We'll have help for rural hospitals who, unfortunately, are not going to be spared the impact of this pandemic. We have resources to support broadband access. We take it for granted here in the Senate, but it's going to be critically important for keeping people connected as we encourage them to disconnect and stay apart. We're securing funds to support childcare. We can't ask communities close down their schools and still rely upon their first responders and medical providers and those on the front lines when their children do not have a safe place to go. We're providing direct appropriations to support a science-first approach to this pandemic by providing funding to back research in therapeutics, vaccines, and treatments. And it's in our communities, state and local governments, who are on the front lines of this crisis. Well, we have to support their efforts. They're going to do it, they're going to fight for us anyway, but they need our help and our support. So we will be including billions of dollars to support the services these communities are providing during this crisis. I said again that it is time for reality to trump rhetoric. And I've listened to the rhetoric on this floor the past few days, some accusing Democrats of delaying critical assistance to America. Well, of course, that's ridiculous, and we all know it is. Democrats have spent the last 48 hours fighting for funding and legislation that's going to help people, not just corporations. We've been fighting for more money for health care, more money for children, more money for hospitals, more money for our schools, and in the last few days we've secured more funding for all these things. Isn't this the American way? Doesn't this transcend party politics? Isn't this what we should be doing, every one of us in this body, for America? So I feel confident we're soon reaching a deal. And I'm well aware of the fact the Appropriations Committee's component is only one part of this massive package. But the pandemic we face demands this response. When I came to the United States Senate, I thought of this place as being and having a history of being the conscience of the nation. Well, let's prove the history true again during this crisis. Whether we do it today or tomorrow, we'll get this done. We'll get it done soon. It will be our conscience that comes through, but not just the conscience of 100 members, the conscience of the nation. a great nation that we're now called upon to support. So let's deal with reality. It's time. We can do it. Every one of us should vote to do that.